Right, back tonight here on In Focus. The Eastern Cape's financial woes seem to have taken a turn for the worse after telephone lines in hospitals were cut off due to alleged non-payment. This is a report by News 24 that the health department in the province owes Telkom over 60 million rand as it struggles to meet its financial obligations due to dwindling cash reserves. The DA's Deputy Spokesperson for Health, Dr Karl le Roux, joins us now for more on that conversation. Dr. le Roux, good to have you, and thank you very much for your time. What could possibly be happening in the department that is seeking attention?
Well, it seems like on the 1st of September, a whole lot of hospitals in the province's lines got cut because of non-payment of Telkom bills. So there were several hospitals that were cut off, but most importantly, the Emergency Medical Services Centre in East London and Umtata also were cut off, which was a complete disaster because it meant that hospitals were unable to contact ambulances, people were unable to contact ambulances. And so we had real trouble with getting patients transferred from lower levels of care to higher levels of care, particularly people who were acutely ill and who needed, for example, surgery at a higher level hospital.
And the department, has it responded to this challenge? What are they saying? What is the intervention in place?
Well, you know, there was a real concern from clinicians on the ground. I think it's incredibly demotivating for them and also incredibly awful for patients. And we know of at least 2 patients who died as a direct result of these delays in transfer. We've called for the Department of Health in the Eastern Cape to pay the bill as soon as possible. And it seems like that call was heeded, and on Friday that some of the bill was paid. We don't know if the whole bill has been paid or just a part of it, but it does seem like most of the hospital's lines are now working again as of today, as far as I know, and that the emergency medical services can again be reached. Bishu Hospital, as far as I know, is still one of the hospitals that is out still, and so I think there's obviously concern that this might be a recurring theme if the bills were only paid for a month or 2. If they don't get paid on time again, we might have this situation happening again. But I think the bigger issue is that we're having a major budget crisis in the Eastern Cape Department of Health. And this is but one symptom of a much bigger problem. This is but the tip of the iceberg. And this is something that needs to be dealt with very, very urgently and very seriously.
What does that then say? I mean, what is this indicative of? You have been in the system, you've worked in the system. What is bringing about these challenges?
Well, I think you know, I worked in the rural Eastern Cape for 16 years, and you know, there have always been challenges with budgets. There have always been ups and downs, but I think that the current budget deficits are of the worst that we've seen, and I think that it's an indicator of what Prof Karim, who presented to the Health Portfolio Committee recently, said. Is that we are really struggling with management and leadership in the Department of Health in the whole country, but specifically in the Eastern Cape. We don't have enough people with the right skills. We have a serious lack of capacity. There's also real trouble with corruption, and we're seeing lots of money being lost. And so we, for example, know that there are many specialists in Umtata who are full-time paid, excellent salaries in Nelson Mandela Academic Hospital, and who are working full-time in private, and that is completely unacceptable. And they're getting paid massive salaries, and they are hardly in the state sector. We see that overtime is being abused. We see that there's been lots of wasteful expenditure. We've seen that the Eastern Cape Department hasn't been able to have a clean audit for many, many years. And I think that this shows that we need to inject capable people into the system. We need to make sure that we can get financial controls on top of things, and we need to decide what the most important things are that we can do. And I think there needs to be this needs to be taken very seriously. I think at this rate, the Eastern Cape Department of Health might be put under administration if it continues like it is as it is going at the moment.
Now, I mean, if you speak to the Premier in the province, he'll tell you that the turnaround plan for the department is on the up and up, and things are beginning to look better. They are, I think, quite recently they would have opened, if not a new clinic, it was a new hospital, if my memory serves me well.
I mean, I think you know, obviously there are different funding streams. Some of for example, some hospitals get paid by public works, so that isn't really an indication of the health or the financial health of the Eastern Cape Department of Health. Our indications are that the Department of Health have been have been so behind that they've already pretty much run out of budget for the year, which ends only in March of next year. So we are sitting with real trouble, and what we've seen happen again and again is posts get frozen, the posts of critical workers like nurses and doctors at the front line of healthcare delivery, and this is just so terrible for the patients of the Eastern Cape and people coming to seek care, and so I think that we really have a crisis, and we need to take it seriously. We've had turnaround plans. Ever since I started working in the Eastern Cape in 2002, and every few years there was a turnaround plan, and we just got deeper and deeper into trouble. And I think that the financial situation of the country is such that the Treasury doesn't seem to be wanting to bail out anybody anymore. And so we need to make some serious steps. There's some positive steps that are coming. For example, that a lot of the smaller hospitals are being rationalized because they are too expensive, and that some of them might be turned into community health centers, but there is some serious thinking that needs to happen and needs to happen urgently.
Yeah. As far as the challenges like this are concerned, you're saying there's a lack of skills. Is there leadership, though? Is there decisive leadership, political and otherwise?
Well, I think that we are delighted to see that there has been a new SG appointed, or the old SG has been brought back, and she is certainly a capable person who makes things happen. But I think that there needs to be political will as well for these changes, and I think that and for proper budgetary control, and I'm not sure if that political will exists. I hope that it will. I hope that the Eastern Cape Department of Health will see and understand the seriousness of the situation, but it is really a situation that needs to be taken very seriously, and we need to pull out all the stops. And I certainly hope that the political will be there to do this.